Okay, welcome again, and today we are going to continue with our session about the lung vascular diseases, and today we will look about the pulmonary infarction. Okay, what is pulmonary infarction? The pulmonary infarction, this is the phenomena which happen when the lung tissue dies, and what's caused the lung tissue to die is due to the blockage of blood supply. We know that the lungs are being supplied by pulmonary arteries, and this when it happened, there is a blockage of blood supply to a certain section of the lung, and this will cause what we call the pulmonary infarction. As we see from these two pictures, these are try to show how about the lung infarction, or how about the lung infarction present. You see this we call the lead infarct of the lung, and always the lung infarction is the lead infarct. Okay, another picture which show the infected region of the lung. This is the slide we show this the infected region of the lung. Okay, we are going through what are the causes of the pulmonary infarction. We have seen that one of the causes, the major cause is about the blockage of the blood supply to the lungs. So what caused the blockage of blood supply to the lungs is what we call pulmonary thromboembolism. This word thromboembolism, it means there will be a pulmonary embolism which comes after the thrombus, dislodge the thrombus from certain part of the body and go to the pulmonary arteries, for example the pulmonary trunk, and then dislodge there and then cause what we call a blockage of the passage of the blood. And always the pulmonary embolism or pulmonary thromboembolism in a large percent, for about 85 up to 90 cases, it occurs due to deep venous thrombosis, and this deep venous thrombosis originate from the lower limb or lower extremities, and this will go to the lungs and then dislodge in any part of the lung, support in the pulmonary trunk, and then it will cause the blockage of the blood supply to certain parts of the lung, and therefore what will happen after the blockage of the blood supply to the lungs is what we call pulmonary infarction, and this is shown here, the pulmonary infection. Okay, I have talked about this one we call pulmonary thromboembolism, and the slide that shows the pulmonary thromboembolism. This is an emboli that is dislodged in the blood vessels, let's say the pulmonary artery, and then will cause the blockage of blood supply to the lungs, which will then cause the pulmonary infarction. Okay, thanks, and don't forget to subscribe my channel in order to get more update videos, and we will continue with the session number 4, which will discuss about how pulmonary hypertension is caused. We know that pulmonary hypertension is the one of the lung vascular diseases, and therefore we are going to look about the pulmonary hypertension. Don't miss this session. Thanks.